and Dr. Bochini. Dr. Bochini is the president of Doctors for Change, in addition to a doctor of pediatrics and infectious disease at Baylor College of Medicine and Texas Children's Hospital. She'll be speaking with Dr. Bar-Eli, who is an assistant professor of family medicine at UT Houston, as well as vice president for Doctors for Change. Welcome to you both.
Hi, good afternoon. I'm Bar-Eli, and thank you for coming. We're with an organization called Doctors for Change, which is a local Houston organization. We're called Doctors for Change, but we're really all kinds of healthcare professionals, lots of people in public health, nurses, social workers, and other just citizens that are concerned about improving healthcare outcomes in Houston and Texas. We decided to keep the name Doctors for Change just because we thought it sounded cool. But we love everybody to come and join our organization. We're a 501(c)(3). We're nonpartisan. We have about 500 to 600 members, and we try to improve the healthcare outcomes of Houston, and specifically, and we work a little bit in the Texas-wide as well. We work a lot with other community organizations. We work a lot to educate both healthcare professionals and lay people about problems that are occurring in the Houston area in terms of health outcomes. We have a couple of committees, including an Access to Care Committee, Prenatal Care Committee, Mental Health Care Committee, and the Anti-Human Trafficking Committee. So these committees set up their own things as well. For example, we're about to have a bus tour where we drive around the city of Houston and learn about places that are involved in human trafficking, and then teach physicians and other healthcare professionals how to spot trafficking victims. We work a lot on advocacy in the Texas system. So Claire and I were both in Austin on Wednesday meeting with a million senators and representatives about different legislative agendas in Austin. And that's been really fun to learn about. So we have a pretty extensive legislative agenda for the 2013 Texas legislature. We're very concerned about accessing care. So I've been very involved with a bill to increase funding for graduate medical education spots. So that's money to train physicians once they're done with medical school and they're in residency training, especially in primary care fields where they're needed most. So pediatrics, family medicine, mental health care in this state is quite abysmal. It's the 50th in the state. And so psychiatry and other things. And I'm happy to report that the Senate bill that passed on Wednesday does have increased money for graduate medical education and replenish the funds for the physician loan repayment program. So those things are both really cool. But it's kind of a generalized graduate medical education fund. It's not specifically for primary care yet. So we're trying to get a Senate bill through that would kind of cater those funds, not just to the institutions so they can choose whatever residency programs they feel like having, but actually what the state of Texas needs. We also are trying to expand Medicaid in the state of Texas. I don't know if you've been reading the news, but that's harder said than done. So we're trying. We also are working a lot with obesity prevention and wellness programs that are school-based and public health-based. Increasing access to mental health care, which for the first time in the state of Texas is actually an issue that people are excited about because they don't want to limit guns in the state, but they don't want Newton to happen in Texas, so they're excited about actually dealing with mental health care. So we have very conservative representatives actually excited about increasing mental health care, so we should really take advantage of that. Parenting education. And then this year I see a lot of interest in anti-trafficking laws. A lot more of the legislators we talk to know about human trafficking as a problem and are excited to pass bills that'll happen. So I think the task force was really successful in that. We have a lot of collaboration with other organizations. We're very intimately involved with Children at Risk, and together with the Kinder Institute at Rice University, we're about to start a Center for Health Child Advocacy, and hopefully, if you guys donate some money, hire a full-time staff person, which we're very excited about, that we're going to share between all three of those organizations. And that person is going to help us kind of study different interventions that we're making in the Houston setting, including school-based initiatives and population-based initiatives, and kind of see how those things are happening. We also write op-eds in the Houston Chronicle, and so we do lots of fun things. So I'm going to talk today about kind of some of the problems that are facing us in Houston and Texas, and then and then kind of talk about some of the solutions that we're talking about. So Houston has a lot of problems with access to care, poverty, and food insecurity. So does anybody know how many children are uninsured in Texas? So we have about 25 million people in Texas, and we have about 6 million uninsured people, which is about a fourth of the state. It's the highest percentage of almost any state in the country. And then we have about 1 million uninsured children in Texas, also one of the highest in the country. It did get a little bit better between 2009 and 2011. It went down from 1.2 to about 900,000. But about 50% of the people that are uninsured right now, of the children that are uninsured in Texas, do qualify for Medicaid. Adults in Texas do not. They have to be just abysmally poor, make less than $5,000 a year or something to qualify for Medicaid. So just being poor does not qualify you for your Medicaid in Texas. You have to be a child or a pregnant woman. And so one of the things that the Medicaid expansion would do is make it similar to other states where poverty actually allows you to get into Medicaid. So hopefully that will happen. So 1 in 3 children in Texas are on Medicaid. And Medicaid covers about, if you're an OB or do any OB, Medicaid covers about 50% of births in this state. Women get emergency Medicaid when they become pregnant, and then Medicaid pays for the child to be born most of the time, about 50% of births. So one of the problems we have in Texas is we have a huge physician shortage area. So in the nation, you have about 81 physicians per 10,000 population, and in Texas, it's only 68. That doesn't sound like a big deal, but there's actually great population data that says that for every increase in 1 physician per 1,000 people, you decrease ER visits, you decrease unnecessary hospitalizations, and you decrease unnecessary surgeries. So in other words, if someone can get preventative care and treat their diabetes, they don't end up with a foot amputation. It's not rocket science. But unfortunately, we don't have enough primary care physicians. We also rank 50th in mental health providers, so we really don't have enough psychiatrists and child psychiatrists especially. And if we do have them, they tend to not accept Medicaid because there's just not enough. And all these red counties are places that are considered healthcare professional shortage areas. You can see that west of I-35, it's most counties in Texas. So if you're not in the triangle, which is Dallas, Houston, San Antonio, Austin, there's most counties are physician shortage areas. So why does Texas have so many uninsured people? People think that it's unemployed people, or there's sort of this vision in your head that it's sort of the person's fault. Well, the truth is in Texas is that a lot of the jobs that we have are low-income jobs that don't provide health insurance. And so these are working poor that just don't get health insurance from their companies, and then are in poverty and cannot afford the ridiculously high cost of premiums that healthcare has become. And then it's very, very hard to qualify for Medicaid as a family. You have to make less than the federal poverty level, and you have to have a child. And the child is very easy to get it, but the adult in the home, it's very, very difficult. And you have to renew it every 6 months. So I don't know about you, but if I had to renew my health insurance every 6 months, I would probably lapse at some point because, I haven't renewed like my car registration in I don't know how long. So things just happen. And I have my life pretty well together. I'm a doctor and I have a house and da-da-da-da. Imagine if your life is pretty complicated, but every 6 months you have to go to Medicaid, which is a huge bureaucracy, and renew your Medicaid. It's very, very difficult. So my patients constantly come in and they're like, oh yeah, that thing ran out and I didn't have my heart meds for 3 months. And now they're in heart failure and I have to admit them to the hospital. So it's a huge cost burden. And our state does that a little bit on purpose because they want to reduce the rolls because Medicaid costs money. We also have some undocumented workers, some undocumented people in the state. And the Affordable Care Act sort of didn't address that problem. So even if hopefully everything happens according to the Affordable Care Act and we do expand Medicaid, we still haven't dealt with any of the undocumented workers in Harris County or Texas. And so there's lots of research that shows that if you don't have health insurance in this country, you have worse health outcomes. You're not as likely to see a doctor. It costs about $100 to see me if you don't have health insurance. My front desk won't even let you in the door unless you have $100 in cash. And I work for the state of Texas at a nonprofit institution. So I can't even imagine what a private clinic is like. So it's very hard to see a doctor. It's very hard to get medical care treated preventively. You're less likely to get immunizations, more likely to have a complex medical problem instead of actually do preventative health care, more likely to miss school, and therefore the parents have to miss work. A lot of these parents don't have sick days like me and you do, and so then they're missing work, they're missing money, and that becomes more of a problem. And then they're much more likely to go to the emergency room for routine healthcare costs, and then that really increased costs because the average ER visit is about $1,000. And if they don't have a medical home and they're going to the ER all kinds of times, that also increased costs. So another problem we have is that, well, this is actually great. We increased how many people are in Medicaid in Harris County. So from 2000 to 2011, we increased significantly the number of people that are actually enrolled in Medicaid. But the problem we have is that less and less doctors are actually accepting Medicaid. So just over the last 10 years, which is not a very long period of time, we went from having about 65% of physicians in Texas accept Medicaid to now about 30%. And that number is dropping all the time. Medicaid reimburses at a lower rate than private insurance and even Medicare. And so a lot of doctors say, well, this is just not cost effective for me. You know, I'm in demand and I can take United and Aetna and get this much money for my visit, or I can take Medicaid and get this much money for my visit. Why would I do that? And so we have a lot less physicians accepting Medicaid. And so this is before we expand it. We already have a giant physician shortage area and not enough doctors accepting Medicaid. So even if we could convince Rick Perry to expand Medicaid in this state, there's going to be a huge problem with not having enough doctors to actually see those people. And then there's lots of research that shows that when you do get a Medicaid card, you actually still have a hard time accessing care. So it's hard to find a doctor that accepts Medicaid and is accepting new patients. And then when you try to get into subspecialty care, it gets virtually impossible. So I see a lot of people that really, really, really badly need, I accept Medicaid and I see tons of Medicaid patients, and they really, really badly need mental health services, psychiatry, other things. And it's basically impossible. There's like a 3 to 6 month waiting list in Houston for my patients to get into a psychiatrist. And child psych is even worse. And orthopedic surgery is very difficult, and a lot of these subspecialties. And so it's just very, very difficult and frustrating when you're trying to take care of your patient and they just can't get in. Adults in Texas who have Medicaid don't have any dental coverage. Children do, but then they have this card. And again, there's not very many dentists that accept childhood Medicaid in Texas. And so this graph just kind of shows how likely you are to have untreated dental carie. And I've hospitalized patients and had to intubate them and put them in the ICU for a dental abscess that basically caused a submandibular abscess. And then we had to do an emergency tracheotomy. So instead of taking care of a cavity, we're now intubating people and putting them in the ICU for 3 days because that's cost effective. So I'm going to let Claire take over.
I'm going to try. My voice is a little bit off. And I think we just heard that we only have 1 minute left, so we're going to go fast. Compared to the rest of the world, we spend a ton of money per person on healthcare, and yet we don't even have very good outcomes. We have a year, 78 is our average life expectancy. Can everybody hear me? Sorry. And yet the average life expectancy for developed nations is actually higher than ours. We have the highest rates of obesity, and that's a huge issue. And then the thing that bothers me the most and what our organization really works to eliminate are healthcare disparities. The people who don't have access to care are the people with the worst life expectancy and have the poorest health outcomes due to their social environment, socioeconomic factors. We know when you ask the question, what matters more, your genetic code or your zip code and your health outcomes? Here, it's your zip code, unfortunately. Neighborhoods that are low income have a life expectancy in Houston in the 60s. Neighborhoods that are, high income have an average life expectancy in the 80s, and that's if people live to 50. We're not talking about violence and other things. We have a huge issue with healthcare disparities right here in Houston, and it's complicated by poverty and food insecurity. And we're really trying to address these because we know poverty is linked to obesity, mental health disease, even poor outcomes in infectious diseases. And so that's something that we really work to try to eliminate. I usually go into more detail into this, but we're going to go fast. We have a huge problem with poverty in Harris County. A third of Harris County children live in poverty. Actually, 50% live at or near poverty. And so these people have a difficult time providing basic services for their family. Food insecurity, we have about a third of children who live in food insecure homes. How many people know what food insecurity is? That means you don't know where you're going to get your next meal. You don't have enough money to provide food for your family. And so much of our health relies on our ability to eat a decent meal and high nutrition food. We have fewer supermarkets than any other area in the country. Actually, in Houston, we could support about another 185 supermarkets, and so people don't have a place to buy, fruits and vegetables, healthy produce. The Food Trust did a study of Houston and actually showed that the areas in Houston where there aren't supermarkets are also the same areas here in red where we have high mortality from health-related disease like obesity and heart disease. We also have a huge problem with obesity. Up to 47% of Harris County children are overweight or obese right now. And that's because it's so easy to spend money on high-calorie food. And actually, just quickly, cost per serving of macaroni and cheese versus salad, it's like less than 10 cents versus, $1 to $3. So it's hard for people to live healthy lifestyles here in Houston. And there are a lot of positive things. I don't want to talk about all these negative things and not talk about what's going on in our community. Everybody is trying to address food insecurity. And there was a huge, a report that was just released in January that's kind of trying to show how Harris County is going to tackle this issue. We have a bunch of people who are trying to do some initiatives to improve access to produce and also provide more food at the schools. Poverty is a huge issue, and until our state really tries to address it, we're going to be tackling problems with poverty for a long time. And there are some people who are working on expanding access to care as well. And I think that also a big thing that we could do is actually learn from other countries. There are a lot of talks today on community health workers and their involvement in other countries. And our organization believes we could really benefit from using community health workers here in Texas as well. And just so that you guys know, since all of your patients are going to be dealing with these problems, you can actually help them and be their advocate. 50% of your patients are in low income. A quarter of them are going to have difficulty accessing food. You can call Texas 211 and actually help your patients get hooked into the food bank and have other access to other social services. There's also an organization called Gateway to Care, and they have a number where you can help people get access to care, even if they have no other resources, even if they're undocumented. So that's a great number that you can call if you have a patient that needs access to care. So I'd like to thank you, and if you have if you're more interested in these healthcare disparities, we're having a meeting on Wednesday night, and you can go to our website for the details. So thank you very much.
Our website is doctorsforchange.org, and we're also a Facebook group. So on Facebook, you can just look up Doctors for Change and friend us and then kind of find out about all our stuff. But this Wednesday, we have a meeting. Thank you so much.